So my talk today was about the management of symptoms in women with breast cancer. And I focused quite a bit on the post-treatment symptoms, specifically in women who survive breast cancer. So some of the kinds of symptoms that we talked about were fatigue, difficulties with sleep, difficulties with hot flashes and sweats, sexual difficulties, depression, anxiety, lymphedema, many common symptoms that women experience. I think the focus of what I was communicating to the oncology audience was that it is important for the oncology treating team to ask about these symptoms, because many people think, well, when the cancer treatment is over, everything should be back to normal. But for many women, they have symptoms that they never had before. Everyone expects to lose their hair or have nausea during the cancer treatment, but they don't expect to still have lack of energy, feeling blue or depressed afterwards, when everybody thinks, oh, you should be happy, we got it all, everything's under control. And for the patient who may be experiencing some of these symptoms, she may feel that she's the only one, and the oncologist may say, oh, the cancer's not there, you shouldn't worry about this, when in fact it may make her quality of life very poor. She may not be able to work, she may not be able to do her usual activities that she enjoys. Well, I think the key thing is that if we don't ask, the patients don't tell. And it's only a very brave patient who will raise the question of, say, sexual difficulties or trouble with thinking or emotional difficulties. And so it's really the obligation of the physician nurse team to systematically ask about all of these things. In addition, we should try to prevent some of these side effects if we can. So for instance, with lymphedema, if we are careful and we don't do extensive surgical removal of the lymph nodes, if we are careful about our radiation treatment planning and advise patients properly about precautions that they might take, we can hopefully prevent this kind of problem from occurring. And so careful, better treatment, more targeted treatments, avoiding chemotherapy if it's not necessary, because it causes a lot of side effects. Well, I think for the patient, it's important that she understand that there can be long-lasting effects after treatment, that it may take a year or more to recover, and that is normal. But when she's having persistent symptoms that don't get better, she needs to ask about it and ask for getting help. Just as we would want somebody's pain to be treated, we would want their fatigue, their sleep disturbance, whatever symptom that they might be having, and that it's not okay to just suffer with those symptoms. And in many cases, there may be strategies that can be used that will be helpful.